My name is Takaomi Taira. I have been working in the field of so-called functional brain operation for more than 40 years in Tokyo, Japan. And probably most of you don't know about functional brain operations, in which we treat patients with Parkinson's disease, abnormal movements, very severe pain. My preference of treatment is the so-called stereotactic operation, and in which we use a device to pinpoint the structure in the brain to relieve or to improve symptoms such as shaking hand like this, and we can easily stop such kind of abnormal movements, for example in patients with Parkinson's disease. And also I am very much interested in the treatment of dystonia. Probably most people don't know about dystonia very much, but if you hear about the term dystonia, you may consider it's a very severe twisting body, generalized and almost bedridden. You may imagine such kind of patients. But dystonia occurs everywhere in the body, around the eyes, face, or fingers. And the famous name, writer's cramp. Probably most people know about writer's cramp. It is a kind of focal finger dystonia, which is also effectively treated with stereotactic brain operation. Those who use hands and fingers repeatedly every day, so it is very common among professional musicians, such as guitarists or pianists and so on. And if they are professional and once suffered, they cannot survive as a professional life. And so for them, the treatment of brain operation is very important, and there are no other effective treatments. Dr. Sharan was with me in Japan for a while, and he studied a lot, very hard. He worked very hard in this field, and now I am sure he is the most top leader in India in this field of functional neurosurgery. So if you had such kind of symptoms, if you think you have dystonia, tremor, Parkinson, you should go to Dr. Sharan.
A field of interest is Parkinson's disease, other movement disorders that includes dystonia, chorea, botulinum toxin injection, and medical and surgical management of Parkinson's disease as well. As a team, we work together, myself and Dr. Sharan Srinivasan. He is a neurosurgeon, but myself is a neurologist and movement disorder specialist. So first, initially, we will work up the cases, and medically, I try to manage myself. In case the disease is progressing and resistant to the drugs, then we opt for the surgery. That is, after discussing with the patient, we put up a detailed plan to them, and then we tell them this is the medicines has got limitations. After that, we need to move on to surgery. Surgery depends upon the financial condition of the patients. We do have two types of surgery. One is a lesionectomy, that is a small burning, making a hole in the brain. Number two is the DBS, deep brain stimulation, nothing but attachment of pacemaker across the chest, and the wire is passed into the brain and constantly stimulating the brain with that pacemaker. This DBS is very costly. Those who can afford can be tried upon. And whereas lesionectomy is a small hole surgery done, and it's financially it's and that is reasonably it's cheaper. Usually we do on one side. Depending upon the progression, we have to do opposite side.
Neurosurgery does not just stop at curative neurosurgery. Okay, curative neurosurgery is only valuable to the patient, okay, as an acute measure. But what happens in neurology and neurosurgery, most of these acute crisis situations get prolonged into chronic situations. And since neurosurgery and neurology deal with the brain, they lead to a lot of disabilities. They lead to a lot of functional, inadequacies, and patients find it very difficult to recover from the long-term effects of neurology and neurosurgery as compared to the acute phase, which they can be operated upon. They go to the ICU, they are on a ventilator for a few days and they come out of that. But then the grueling process starts after that, when they get into disabilities and dysfunctional statuses, and that is the time when the services of a good neuro rehab service comes into play in the overall holistic management of a patient, to bring him back either to normalcy or to near normalcy.